Health in Africa, Digital Health in 2024, and how we can chart the future in Africa. Particularly now, we all know how digital health pace has been so far in the continent, and it's been taking progress, yes, but we still need more progress, and we can't continue talking about the problems all the time. So how we can be solution driven, and most especially how we can chart the course for the future of digital health to progress more than it currently is in Africa. So thank you so much for joining us. And today we're going to be having two intellectuals talk about their experience so far and also like give context for us. Well, before that, we would do a quick introduction, your name, country, city, what do you do, and organization. So you can just drop that on the chat box while we wait for our speakers. So yeah, forgive my manners. So my name is Taufikat. I'm from Nigeria, but I'm currently in the UK. I'm a public health expert and I work with the Ministry of Health. So yes, we can just follow that format on the chat box while we start to introduce ourselves. I can't see anybody introducing themselves on the chat box. Oh, great. Thank you. We have someone from Kenya. Thank you so much for joining us, Village Rich, and Edwin from Kenya. Let's keep it going. We need to like know the country representation here so we can like at least touch on all of the country progress generally in digital health. Nice. We have someone from Benin Republic. We have someone from Zambia. We have Tandy as well from Malawi. We have from South Africa. Oh wow, this is thank you so much for joining us, Dr. Steve from US. We have a really great country representation today, and I hope that we're able to like discuss our country's progress as well. All right, so I'll be handing over to Vivian to talk a little bit about Digital Health Africa and also Elena, our partner for today.
Thank you so much, Taufikat. All right, good evening, everyone. Good afternoon, good morning, depending on where you're joining us from. My name is Vivian, and I head operations at Digital Health Africa. At Digital Health Africa, we are focused on leveraging media and publication strategies to drive change in the healthcare landscape across Africa. And essentially what we seek to do is to disseminate digital health information, the latest trends, and foster dialogue and catalyze action to improve healthcare outcomes on the continent. Our vision is to be the foremost digital health media organization driving transformative change across the African continent. So you'd see activities are around disseminating information about digital health and the progress across different countries on the continent, and also fostering community engagement through different networks, the Digital Health Student Networks, as well as the African Digital Health Professionals Network. That is that about Digital Africa. You can find much more information about us on our different social media platforms. So for this webinar series, we are collaborating with Helena. So Helena is the Health Informatics in Africa, which is a Pan-African Health Informatics Association and the African regional body of the International Medical Informatics Association. And the vision of Helena is to transform healthcare in Africa through health informatics, research, development, implementation, and science. So you can find more about Elena on their social media platform as well. We'll share the link in the chat session. Thank you so much for joining us on today's webinar series. I would hand over to Taufikat now to start the conversation with Isaac.
Thank you, Vivian. Isaac, welcome to this. I'll be doing a brief introduction of who Isaac is. Next slide, please.
Thank you. Thank you so much.
Hi, Isaac. I would allow you to introduce yourself first before we get into the nitty-gritty of conversation. So please go ahead.
Hi, everybody. Greetings, Digital Health Africa team. Thank you so much for the invitation. I can see a few friends I've worked with in the past. I can see my brother Mahun from Benin. Good to see you, brother. I can see Madam Mono there and a few close friends we've worked with. It's amazing. My name is Isaac Pomboloka from Zambia. I'm a digital health expert, as was a 2023 Mandela Washington Fellow. Sure.
Thank you, Isaac, and nice to meet you again. I know this is the second time we'll be meeting. So basically, before we jump right through the conversation on trying to chart the future of digital health in Africa for 2024, I think we need to understand what really are the current trends in digital health adoption across Africa and how they actually compare to global trends. So you're in Zambia, for instance, what are you seeing as the current adoption of digital health in Zambia? And do you feel in relation to other African countries, what are the progress indicators that you can talk about?
I don't know if the question is directed to me though. I think I was having some internet challenges. If it was, maybe you can just ask the question.
Oh, no worries. It was directed to you. So I was going to let us have an open conversation before diving into specific questions for you. So I was asking what are the current digital health adoption trend in Africa, most especially in Zambia that you're currently in, compared to other African countries. Do you think there is progress or do you think there is decline in digital health adoption?
Oh, great. A great question. So to start with what is currently happening in Zambia, I think we've seen some good progress, especially where development of regulatory framework for digital health is concerned. We have seen quite a lot of progress, especially from the Minister of Health, where a lot of digital health technical working group are being set up and implemented. And we just And recently we had a digital health institute in Zambia, currently in the capital city of Zambia, in Lusaka. So the Ministry of Health and through our government have been very strategic in trying to ensure that they set up the leadership structures that are needed to drive this digital health revolution in the country. And apart from that, we have seen quite a lot of organizations that are coming on board, trying to address various facets of healthcare delivery and trying to see how they can use digital health technologies to enhance the quality of care that is being given. For example, we've seen the projects that are being implemented by Moore School of Medicine, where they are trying to revolutionize the delivery of healthcare, especially to people who are living with HIV, where they are linked to specialized care. So no matter where they are, if they are based or they are nearby sites where they can find a telemedicine site, they are able to be linked to a specialized care without them having to go there physically. So there is so much interest from international organizations currently in Zambia, and most importantly, there's been so much progress even through the government to ensure that we digitalize the kind of healthcare delivery that we're giving, and more especially in the HIV management and programming. We have seen a development of Smart Care Zambia. So Smart Care Zambia is a digital health tool which is used to ensure that there is continuity of care, especially to people living with HIV. So much of the records are electronic, and much of their data, including the clinical workflows, are actually done through that programs. So in the near future, I do anticipate that with the progress that we are making, we are going to be at a very good spot, especially where setting up all the necessary frameworks around digital health.
Thank you so much, Isaac. That sounds like progress. And I know Zambia is currently like having issues with cholera outbreak, and I really hope that things get stabilized soon. But generally, I feel like the digital health adoption across Africa still remains at that pace that we keep talking about. Like we're getting at things are still getting adopted to the system, and in 2024. It's like we need to quicken the pace. Yes, they say slow and steady wins the race, but sometimes you have to be quick as well and while being steady. So thank you so much for that insights from Zambia. I also am curious, from your experience so far working with the Moore School of Medicine Telehealth projects, what would you say are actually like the main challenges hindering the widespread adoption of digital solutions as working in that field as well?
Okay, thank you so much for the question. Yes, so I've had an opportunity to work on a digital health project, specifically a telemedicine project by Moore School of Medicine since its inception up to where it is right now. We started from seeing only 7 clients. I think I remember when we launched it somewhere back in 2021 in June, somewhere there, we saw only 7 clients to where it is now. It has seen over 7,000 clients that have been seen through telemedicine. So this project has been amazing. It has been a life changer, especially for people who are living with HIV in the capital city of Zambia, because it covers over 5 clinics as well as 7 hospitals, including our University Teaching Hospital. But this project has had its own challenges that I've actually critically learned from. And the first challenge that we've seen is that most of the time, the partners, including ourselves, who are the people in forefront to provide such interventions, we don't realize early that it's not technology that tends to drive digital health interventions. We tend to forget that. And as a result, we focus so much on technology instead of focusing so much on something that truly matters, and that is the clients that we serve. As a result, we tend to come up with sophisticated technology that are not easily acceptable or that are not client friendly. So I've come to understand that in learning such programs, the critical challenge that is there is trying to create platforms that can easily be used by the clients that we are targeting. This is one of the challenges that I've realized. And I've come to understand that where digital health is concerned, we should not focus much on technology as much as it is important, but we should focus more on the needs of the clients. Because if we embrace technology which is solving the direct needs of the people that we are providing such platforms for, that is the hallmark, the basis, the foundation upon which every success of a digital health intervention is concerned. So number one I've seen is that we tend to focus more on technology rather than focusing on the needs of the clients, and hence we tend to miss the link where implementation is concerned. The other thing that I've come to understand, just in line with the same point that I've seen, especially where the challenge is concerned, is that we have started copying and pasting digital health technologies, especially on the African continent, and not forgetting Zambia. We would go, for example, to well-developed countries, maybe the United States. There, mostly maybe our partners or our funders can come from there, and they will come with their own interventions, with their own digital tools, and later on, they want us to adopt exact models that are working there, without realizing that the digital literacy levels of the clients, of the clientele that we serve, is different from that in Western African countries. As a result, copying and pasting those digital health technologies is one of the challenges that we are facing. However, I've come to learn about the importance of contextualizing every digital health tool that we're trying to adopt. We can copy and contextualize it to the needs of the people that we're serving, so that even the people who are in forefront of using the technologies, as well as the people as well as our clients, are comfortable using such platforms. Another challenge that I've noticed is duplication of efforts. You know, we'll have this organization come and they start implementing this digital health project. Another organization is going to come with a different funding and they'll start implementing this digital health project, and the list goes on. As a result, you find that a lot of money and resources are being used trying to address almost similar problems. That's what I've come to understand, especially on the African continent, because much of the funding, especially where digital health tools are concerned, it is not our governments that are in forefront to fund such. So whenever our implementing partners are coming on board, and they tend to implement a lot, but related digital health programs, and that has been a hindrance because we seem to be duplicating the efforts and the exact thing that we're trying to do. And another thing that I can focus on as the main challenge is interoperability. We have a lot of digital health tools that are being developed on the African continent, but much of them are not able to communicate between themselves. As a result, there is breakdown of clients' data or health data. If a client wants to attend services from a different institution, it becomes difficult for them to, for the person who is serving that client, to be able to see the electronic data of that client, because there is just so much breakdown, especially where health information is concerned. We have so many digital health applications and tools that are being created to solve similar problems, and yet these lack international standards that can be used to ensure that these tools are able to communicate and common data is able to be shared, so that there is that continuity of care. So lack of interoperability, lack of adopting international standards is something that I've critically seen, and it is something that I've actually hindered the progress of much of the digital health programs, even in the country. I can give an example of the same project that we implement. We have the Smart Care Zambia. Those people have the mandate to ensure that they digitalize the healthcare delivery in the country. So they have developed what we call the Smart Care platform, which we use as an interface whenever we're trying to actually attend to people living with HIV. And also, there is this organization, for instance, they come in and they develop a telemedicine project, and they start running that project. And when they are running that project, they are running this, they are saving the same client base, but the data they are able to capture and see through the telemedicine program cannot be shared or be able to be, it's not interoperable with the data which is being learned by that Smart Care Zambia. As a result, you find that there is duplication of reports. The report will be sent to say, we saw 2,000 clients, and this other side, other partners will say they've seen 2,000 clients, but all what they're doing is just seeing similar clients. The only challenge is that there is no communication between these two parties. So lack of interoperable digital health technologies has really hindered the progress of much of the the progress of the of digital health, the widespread of digital health, especially. I do believe these challenges that I'm trying to look at is not just in Zambia, but even in Africa as well, because I've had the opportunity to interact even with other digital health experts from other countries. Last point I can mention is lack of upskilling, capacity building programs, especially where digital health is concerned in healthcare professionals. I was at this hospital and I was doing a training for some doctors and clinical officers, and they mentioned to say telemedicine, and someone started asking me to say, telemedicine is all about what? And this is the person who has completed a 7 years training plus, and they have been practicing for quite some years, and yet they are behind where digital health progress is concerned. And they started asking what this telemedicine is about and etc. So lack of having a digital health skilled workforce that can drive this digital health agenda is another problem that we're trying to have. Because as much as we can push the agenda, we can source for funding, and we can push these digital health projects, if we do not have people, professionals, human capital, which is well trained with the digital health skills needed, then we can't go anywhere, and the progress that we'll be making cannot be sustained. So those are some of the challenges that I've seen in the few years that I've actually worked on a digital health project here in Zambia.
Thank you so much. Those are very, very detailed. I mean, I'm like, we should appoint you as the president of the digital health in Africa, but honestly, those were right on point. I think we all keep saying there's like not building products for people, but with people in Africa. And we also have to understand our level and also like contextualize whatever solutions we're developing to people's needs, and not just build for them, but actually build them in the co-creating phase, even in the ideation phase, and also as well in the implementation phase. And you're right about all of the interoperability issues that we're still facing till now. And it's so important that even with all of these challenges, we're also able to like know the solutions to this problem. I'm curious as well from our attendees, especially because we have a lot of country representation and also funders here as well. If they could also chime in on some of the challenges that they've seen, especially in their own country as well. Anyone wants to say something, you can just unmute and speak. Yes, please go on, Maono.
Okay, thank you so much, and good afternoon, good evening to everyone. My name is Maono. I'm from Benin, and I am a nutritionist. And so far, I want to explore how to use digital tools to provide nutrition care in my country and also in West Africa. That's why I quickly hopped into this meeting. And since last year in my country here in Benin, I teamed up with the Department of Health to be a part of some campaign for health, like the distribution of malaria nets to fight against malaria. And this year as well, I am working currently to digitalize the distribution of some medicines to avoid non-transmissible disease. So the problem here in my country is mostly regarding to the tools themselves. Like if we want to digitalize health during some health campaigns, we need, for instance, to use some smartphones by people who are working on those projects. We need to cover all the department or all the region that we want to put part on our campaign, and it is very complicated to our government to be able to provide those tools. And yes, we do have some partners that are working along with us to provide those tools as well, but it is not like what we want. It is not sufficient to move forward with it and get the good result that we want to do. And from my point myself, like I said, currently I want to explore how to use digital to be able to provide nutrition care and look at what our universities, especially in health system, are doing. I want more that they should provide some curricula of training that can help students in healthcare from that moment to have capacities to be able to provide also healthcare or what they are doing in health system by using digital tools. So thank you so much.
Thank you, Maono. That was really insightful. And I think like it just begs the question of how young people also can play a role as well, especially in digital health. And I see comments as well from Lucy from Kenya, who said we have a very good policies on paper with regards to digital health, but actualizing the policy is a challenge. Equally, we have wastage of resources. And I think it all boils down to each individual's knowing, each sector actually knowing the part they play, from governments to funders to people, to the people who are designing these digital solutions for, and even young people as well. And I think it just leads me to the next question of what progress can we make to actually include youth in digital health, and not just as an active user of digital health, but also as a co-creator, implementer, and innovator of digital health, especially in Africa, because we live in Africa, we know our context, we know our realities, and we're actually like able to think of solutions more in terms of like, especially because I know Isaac mentioned a part of bringing the West solutions to solve a solution in Africa. So Isaac, I'm curious, what do you think we can do to make progress in actually including youth in digital health? And it just relates to what Mahmoud said as well, in terms of like, he wants to create solutions in digital health. He wants to use his knowledge of nutrition and digital to actually like make something for his country as well. But before we go into that, I'm curious into what A. Chisale has to say. Sorry if I mispronounce your name.
No, that was very close. Thank you.
Oh yeah, please, what's the right pronunciation?
Chishala.
Chisala. Oh, great. Go on.
Okay. I really like what Isaac said about interoperability, because one thing I've noticed in my work experience is that not only are different sectors of healthcare funded by different organizations, we also have different quality standards, and we're in different places along the journey to achieving those quality standards. So if one particular for example, one thing, I can work in a hospital where there is an information management system for labs, one for clinicians, and one for which the pharmacy uses when buying things. And there are different programs which were installed at different times to meet different requirements. And a department which is like passing audits and doing well in accreditation won't want to merge systems with a system which won't meet which could actually make them fail an audit. So I think if more integrated systems are to happen, then the teams designing them need to be a little more interdisciplinary than they are. And also on the comment of someone can be working for a long, long time and you get surprised that they're not aware of certain platforms. I think one easy way to target the youth is to target them, like the young professionals, as they are still in school, so that it's not that they're learning to do things maybe more manually or paper-based, and then when they've been working for 3-4 years, they go for a workshop where they learn this. It would be nice if from the time they were in school, that's the way they learned to do it, and we can bypass the whole behavior change issue. Those are my thoughts.
Thank you for sharing those really insightful thoughts, because honestly, you're 100% right in terms of the curriculum structure. We need an overhaul. I remember Digital Health Africa did a boot camp sessions for 50 young Africans within the continent on digital, or trying to like introduce them to digital and understand the intricacies of digital health. And also the point that you mentioned about having different systems. I feel that actually comes from a government, lack of standardization from government. And also, like Isaac said, the funders as well, because funders come with this money and they want you to do this project and you do what they want, and then another funder comes. So it's like, it's where you're going where the money is. So it's whatever systems they bring is what you accept at that time. So yeah, those are really like great reflection for us to like reflect on. Edwin?
Yeah, thank you. This is Edwin from Village Reach. I put a comment that just reflecting what you just said about, funders coming with their monies and agendas. But the reality is that I think governments and funders have a key role to play in coordinating the implementation of digital health solutions. And they don't really play this role well. And that's why when that space is not well coordinated and regulated, then people are able to come in with their different solutions, and you have this problem that we now typically call pilotitis, where people implementing solutions that have a specific focus, and they want specific outcomes, and once they're done with that, maybe it's a 2, 3, or 5 year project, then there's no further use of that solution. So that's a problem that governments and funders have a key role in solving. But the other point I wanted to bring and make was this, that I think it's important for government stewardship is key to ensure that we have integration of systems and integration of sustainable systems which are implemented at scale. There was a report that was done by I think sometime in 2021, the Secretariat of the WHO Regional Office in Africa released a report where they disclosed that, and going back to the issue about digital health strategies, there are countries in Africa, about 63% of countries in Africa, which is like 34 countries out of 54, have developed a national digital health strategy. But only 12 of those countries were actually implementing and operationalizing these strategies. I think it's important for African countries, or any country generally, to have a digital health strategy that provides guidance on what the vision is to have nationally scaled systems that can support and digitize the public health sector. And so you'll find that, and I think my colleague from Kenya put this, that we have these strategies that are sitting on desks. They have not been operationalized, mainly due sometimes don't have sufficient funding, or you'll find that we don't have dedicated divisions within the Ministry of Health to help drive the implementation of these strategies. I think nowadays we're seeing countries are increasingly creating a dedicated digital health division within the Ministries of Health. And these are now going to be focused on ensuring that digital health is actually implemented in line with strategies that have been developed to guide the countries on this. So just bringing up the point that it's going to be important for countries to have digital strategies, have dedicated teams that are going to drive the implementation of these strategies, and governments will need to actually invest monies to ensure that this is implemented. So that's my contribution to the topic.
Thank you so much, Edwin. And I'm going to put you on the spot. You can't leave now. I know Village Reach is a major funder and donor as well. So what really do you think, in your opinion, how can we promote the partnership between private and public sectors to actually help the governments in actually operationalizing this stuff as well? Because like you said, we have those policies. I mean, for Nigeria, we have this strategy, and most countries in Africa do have the strategy, but you realize what you have in the strategy is just for the strategy. It not really working out. So what do you think can actually be done, especially in terms of like donors having their own ideas, something not working in a country? How can we merge all of this to actually serve the people and not just serve our own interests?
Well, just to clarify, Village Reach is not a donor. We are a technical assistance organization. We're a global health organization that works closely with governments and other partners to co-create solutions with government. What we do as an organization is identify problems in the public health sector and co-create solutions with government and other partners to build solutions that are going to strengthen these systems. Very specific about co-creating with government and other partners, because when you co-create with government, government has ownership, and those solutions are likely to be sustainable, because at the end of the day, when you start the process, the end idea, the end goal is to transition these solutions to government ownership and stewardship so that they can sustain that over time. So when you bring them in from the beginning, they know that they are going to have to take over these solutions, include that in the national health sector strategic plans, put it in the budget to support that over a long time, and that becomes sustainable. So the issue about funders coming with their systems and driving certain agendas, it goes back to what I was saying, that government stewardship is important. If a government has a strategy and they are very keen on ensuring that they have a goal that they want to achieve, it means that they are going to regulate that space. So if a funder comes in or a donor, and they want to come in with a system, and you have something already implemented in the country that is already solving this problem, then governments need to guide and say, look, we already have a system in country that's solving the problem that your system is supposedly trying to solve. So there are two things that you can do. You leverage on the existing system and you use that to help implement a program, or if your system has something extra that the current existing system doesn't have, then what this donor or organization coming in with the new system is supposed to do is to help extend or build out the existing system to contain the new functionality that is not existing, so that whatever system is already in place that's chosen by government gets improved by increasing functionality, but not duplicating that. So the government has a key role to play in ensuring that people don't come in and just duplicate system. I think the government of Rwanda is a very good case study for this. If you go to Rwanda right now with a solution and you want to implement this to solve some problem in the public health sector, if they already have a solution existing, they will not allow you to come in with something new. They'll only allow you to improve what is already existing. So that's going back to the point that government has a very key role to play to ensure that there's a strategy in place and they regulate the space to ensure that whoever is coming in to strengthen what is already existing and not coming to duplicate.
Thank you so much. That was really profound. And you're right, Rwanda always gets to take the cake all the time about being an exemplary country for us to mold that over, especially in terms of their pace towards digital health and even in other aspects as well. I think I'm coming back to you and hopefully get the final question to you on how young people in Africa can really be empowered to actively contribute to digital health innovations in 2024, and not just as active users of digital solutions, but also as co-creators, innovators, and implementers of digital health. So what do you think are the best strategies to involve young people?
I would love to start by saying I think that was some amazing submissions and valid points from Mr. Edward. It's great that he has brought up those points. So where young people are concerned and where empowering young people, especially in the digital health space, is concerned, I am a firm believer of the fact that the greatest empowerment possible is not something that can be transferred from our hands to other hands, but it is something that can be transferred from minds to minds. I think for me, the most sustainable kind of empowerment that we can do is something which can be transferred from minds to minds rather than from hands to hands. Let me give an example. If we have to get all the leaders in our health sector in Africa and we take them to the United States and we bring the leaders in healthcare space there, they come to Africa in just a year, or if not even less, Africa's healthcare system will end up being like that of the US, and the US's healthcare system end up being like that of Africa, because I think the majority of us here are young people. And one point that I would love to make is that all of us, we need to understand that change and innovation only benefits its initiators. If we have to be mindsets that are going that the developments and the technologies that we would love to see in the country. So it begins with us identifying the problems. It begins with us identifying the skill sets that we have. It begins with us identifying the gaps that are in our healthcare system, and we start asking ourselves how we can use technology
I think Isaac is having network issues. It was a bit muffled from his end, but really, just like he was trying to say, it begins with the youth and young people of Africa actually like identifying the problems and working in tandem to find contextualized solutions that fit the realities of the people in terms of like solving the problems of digital health. Vivian, I'll hand over to you to speak on the workforce.
All right. Thank you so much, Taofikat. A lot has been said about the current digital health landscape in Africa, the current challenges, and on how can we ensure that digital health interventions are being adopted and scaled across board. So my next question to us as audience, as digital health enthusiasts, practitioners, and professionals, is that when it comes to workforce development, because as Edward mentioned, the government cannot do this alone. And to be honest, the government kind of have the leadership and governance, but most times they don't even have the technical they don't have the technical skills or technical insight, right? And then bringing it down to the main users, who are the healthcare professionals and all, who are like the people who are going to use this digital health interventions at the end of the day. So I'd like to ask us on the call that what competencies are required in the digital health workforce, because I believe that we have skill gap, we have existing skill gap. Other speakers have mentioned things like we don't have a curriculum that encompasses digital health, and also from medical school to becoming a healthcare professional, there's that skill gap on how to utilize digital health tools. So what do we think are the competencies that are required in a digital health workforce? And I know I would like to put Esther on spot here. I don't know if she's still on the call. She's the president of the African Digital Professionals Network, a network of professionals in the digital health space in Africa. Hello, Esther. If you can hear me, let me know. Okay, so while we're waiting for Esther, I don't know if we have anyone who would like to just shed more light on how we can develop our workforce, the skill, what competencies are required, because I believe the three P's of digital health workforce development is number one, pipeline, number two, placement, and number three, professional development, right? So in as much as we're trying to develop that pipeline of digital health workforce, where is the supply end and all, and what kind of skills are we going to empower these professionals with? And yeah, so I'm saying Mahuno, I'm seeing your hands up. Please, you can unmute.
Okay, thank you. Yes, it is Mauno. About your question, I think we need, for instance, when we are at university to dive into digitalization, even in health science school. I remember that I did my bachelor's degree at the health science school here in Benin. I spent 3 or 4 years at university, but we didn't talk about digitalization. We do talk about biostatistic, epidemiology, but when it comes to use digital tools, like for example, how I can use even basically WhatsApp to provide nutrition care, or even how I can team up with an IT manager to set up a platform to put healthcare inside this platform to be able to provide what I am learning at health science school to people. We didn't talk about those stuff, and today now it is our first gap. I see people in the US use digitalized tools for everything they are doing. If they have a service to give to people, know already that they have also the capacity to put this service on digital tools and to be able to provide it. So I think it is the same thing we can do here. Currently, I am a technology and training administrator on those health campaign. And what I do is how we can use some apps like ComCare or Kobo Collect to be able to provide those nutrition care to people. It is the same thing. Get started by talking about digital tools at university. We are right now in full development of AI, and I think it should be also a component or a part of our curricula at university. But it is not like that right now. They keep up with those last curricula and keep teaching people, university students, but it is not good. It's not fair for us because in years to come, we will be like come back to the same thing with the same gap. So how we can use AI, for instance, to be able to provide healthcare, and students can at that time start to dive into those subjects at university. Thank you so much.
Thank you so much, Mahuno, for that submission. I agree with you totally that we should start taking digital health literacy very serious, very, very serious, because we've had a consultative session last year with one of our partners from JSI, former JSI. So she mentioned that there was a particular digital health intervention that was carried out in our community, and it was after they deployed the solution they realized that the healthcare professionals could not even operate a computer. So it's like you are jumping the gun, or like you're going 4 steps ahead when we should have actually started with the basics, which is like digital literacy, training these professionals on how to use basic ICT tools, not even maybe sophisticated ones, but like how to even use the computer and how. And at the end of the day, I think this is going to help us even with adoption of digital health interventions. I can see Gindo. Hello, Gindo. You can unmute and speak after we have Love Day.
Thank you very much. My name is Gindo. I'm from Ethiopia, working as a regional health bureau. You raised the issue of digitalization as the lack of capacity manpower, but the issue of infrastructure should be raised first, because infrastructure problem is the first bottleneck that hinders the expansion of digitalization in the health sector. Infrastructure is first, fulfill the capacity.
Okay, Gindo, we're struggling to hear what you're saying. So if
continues, because the infrastructure itself
okay, so I think Gindo is probably having internet issues. Hello, Love Day.
Hello, good evening all. It has really been an insightful session so far. But one thing I would like to talk about is, in as much as the curriculum for those in medical school and those that will have to deal with digital health as far as the medical field is concerned, can be tweaked to accommodate some core skills, I still think we should be very, very careful about handling it this way. I still think that there should be a separation between medics and then those that have the technical skills to provide digital solutions. This is why treating as core competencies. Yes, a medic can decide to delve further and get some technical skills, maybe software development skills or data science skills, but the core competency as a medic should not be overlooked. Because when you start bringing in these extra things, at the end of the day, would undermine integrity, the integrity of the medical professionals themselves. Will go for less quality at the end in terms of practicing medicine, so to say. But what I think we can do as African leaders